New guidance from the CDC, it's now shortening the recommended time people should isolate when they've tested positive or have been exposed to COVID-19. The agency says the change comes after studies show transmission usually occurs in the first few days before and after symptoms appear. One health expert tells TV5's Jamie Sherrod, although the change is surprising, he understands why it was made.
It is surprising, yes, and I'm sure people are thinking, how does this even change?
COVID-19 cases on the rise, but the isolation period for those who've contracted the virus declining from 10 days to 5. The Centers for Disease Control and Prevention announcing the recommendation today.
I do believe there are economic and societal ramifications for the pandemic, and that's why the CDC has said, hey, let's do this, because it's between the rock and a hard place.
CMU infectious disease expert Dr. Nicholas Haddad says, although it may seem surprising the recommendation came in the midst of a new surge, the CDC may have felt it was necessary because of the current strain on employment.
There are hospitals that are understaffed. We saw what happened over the weekend with the airline industry, making more people available to service society.
Those who test positive for the virus are required to isolate for at least 5 days. If they continue to experience symptoms, they must isolate for another 5 days. However, those who are asymptomatic after the first 5 days are allowed to enter public areas as long as they continue wearing a mask for the next 5 days. And those who have been exposed to the virus but haven't tested positive should quarantine for 5 days. Dr. Haddad also tells TV5 the shortened isolation time, although concerning, is understandable because of what we already know about the virus.
Because most infections occur within the first 5 days of symptom onset.
I'm Jamie Sherrod, WNEM TV5.